Hi guys, welcome back to another video. Now in today's video, we will be discussing more about the red list countries that I spoke about in my last video and how can you continue to apply to the UK as a healthcare professional if you are from a red list country. So if you are interested in knowing more about it, do stay tuned to this video and watch it all the way to the end. But for those of you who haven't already followed me on Instagram, my handle is physiotherapy in UK, and do consider following me on Instagram because I issue daily updates about living in the UK, updates in the visa, also possibilities of how you can answer and apply for NHS jobs or private jobs in the UK in the healthcare sector. So, diving right into today's content, let's just see what are the sort of key things that you can do for yourself if you are from the red list country but hope to practice in the UK as a healthcare professional. So, one of the first things that I want to absolutely talk about is I know I've said previously in my last video, which I'm just going to leave the link for right now, that obviously UK is going to stop actively recruiting healthcare professionals from other red list countries. Now, I've described all of the reasons for that and what are the steps and what are the references for it in that video, so do have a look at it. But just in terms of this, you need to understand that when I say the word active recruitment, what essentially means is that there are a lot of agencies that have tie ups with local or regional governments, and this sort of bit is known as active recruitment. So, the recruitment from these agencies where people get hired, maybe say 10 or 20 professionals for jobs in the UK, that's what's essentially going to stop. But that doesn't mean that it's going to stop you from applying individually to the jobs. Now, again, for those of y'all who don't know much about this, there are two main websites that I obviously recommend when you are applying for a healthcare position in the UK in the NHS. One is obviously Track Jobs, and the second is NHS Jobs website. So obviously these are the two websites where you can apply specifically for jobs in the NHS. Now, if you are confused about how you can apply for jobs in the NHS, don't forget to check out my these videos, and I've left the link for that playlist right above, but also in the description box below. But if you are someone who's facing constant rejections, maybe you've made 10, 20, 50 applications and are still being rejected, do consider booking a session with me, because in the one-to-one session, I will be able to give you good tips and guidance on what you can do to improve your CVs or your job applications. So yeah, do consider booking a session with me if you are confused about it. But that was my first tip, guys. Start applying individually. Don't just rely on agencies to land you jobs within the UK. As soon as you have your HCPC registration, or as soon as you've applied for it even, start applying for jobs on the NHS or the Track Jobs websites. Now, coming down to the second tip that I want to share with you is another crucial one, because many of you all have obviously asked me, Nikita, should I be doing my master's in the UK or should I be coming for a job? And the answer for it is not very simple, and I've explained what are the factors or what are the key things that you need to consider before you make that decision for yourself. Now, if you are interested in watching that, please definitely check out this video where I've listed all of the reasons why one should do their masters or why one should consider working in the UK just as a professional. But diving into it a little deeper, the second sort of important thing for you to remember in this situation right now is that if you come into the UK as a student, you will be granted the PSW, which currently stands for about 2 years. Now, obviously, there are many ongoing conversations about reducing the duration of the PSW, but let's face it, the PSW is a guaranteed way for you to live in the UK and search for a job. Now, obviously, I think the rules around if you are living in the UK but still come from a red list country is quite hazy at the minute, and you could take advantage of that potentially. You could say that, okay, while I'm in the UK, I'm going to search for a job, and obviously then you're not living in the red list country, or you're not potentially supporting the healthcare system in that country. So that might give you a slight leeway in getting a job in the UK. Now, again, that being said, I can't guarantee that this is a sure shot way or a foolproof way for you to land a job in the UK as even being from a red list country. But because these rules or the rules around sort of getting a job while you're on the PSW from a red list country is not clearly mentioned in the recommendations document that has been issued. Now, again, for those of you all who are confused about what is the recommendations document that I'm talking about, the UK government has actually issued a recommendation document from what it plans to do about all of the sort of red list country and what is the sort of plans that it has for recruitment in the NHS or in the healthcare sector. And if you want to know more about it, do not forget to check the link in the description box below for the video where I've spoken about all of that previously. Now, finally, coming down to the third and the final point of a way around the red list countries and recruitment in the healthcare stream is dependent visa. Now, if your spouse or if your partner has already come into the UK or is planning to come into the UK and you are planning to join them as a dependent, then you obviously have a visa already. That can potentially help you to land jobs in the healthcare sector because you do not need the sponsorship. So essentially, you're not going against the rule that the UK government has set out for yourselves. So this could be another potential route where you could obviously save yourself the trouble of trying to land a health and care worker visa while you are in the red list countries or while you are in a country that is on the red list at the minute. So do consider that if your partner has the potential to come on a work visa, then you can try and come on the dependent visa, and that will make your life much easier in landing a job in the UK. Now, finally, coming down to another sort of major important question that was asked so many times in the comments of my previous video was that, Nikita, what if I'm already living in the UK, either as a student or as a working professional? Does this influence me in any way? And the answer is no, because as of right now, there are no standardized rules around this of how it would potentially affect the people living in the UK, especially if you are from the red list countries. I still know of people who are landing jobs in the UK who are getting work in the UK. So I potentially am assuming that none of this affects people who are living in the UK at the minute, either on a student or a work visa. So if you are in the UK already, I would say keep applying for jobs, guys, because like I've said before, only if you make 100 applications will you be selected for 5 interviews. That's literally what happens, and that's what most of us have gone through. But that's it for today's video, guys. Let me know if you have any thoughts or questions in the comments below, and also do follow me on Instagram because it's much easier for me to connect over there. Take care. Bye.